So good morning, everyone. Good morning and welcome. On behalf of the Steering Committee for the Canadian Network for Neglected Tropical Diseases, I'd like to welcome you to this virtual event for students and young professionals living in Canada called Effectively Integrating NTDs into Global Health Strategies. Bonjour et bienvenue à tous à notre événement aujourd'hui. On est content de vous voir aujourd'hui. So as we begin our session, I'd like to start with a land acknowledgement for where I'm seated today, which is in Ottawa, Ontario, in Canada. We pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. And for those of us joining from outside of Ottawa, I'm sure that you also have an acknowledgement for where you're seated today. La session d'aujourd'hui se déroulera en anglais, mais n'hésitez pas à poser vos questions ou à faire des commentaires en français. On a des personnes qui peuvent nous aider avec des traductions. So we're here today because we care about global health equity and because we want to see Canadians and Canada play a greater role in addressing neglected tropical diseases, or NTDs. You'll hear that acronym used throughout the session today. You'll hear from about some of these NTDs from our panelists today. There are 20 diseases or conditions that affect 1.6 billion people living in the world today. That's roughly 1 in every 5 people. So we want to understand how we can better integrate NTDs into global public health in today's session. We'll hear about integration of NTDs in heart health, integration with WASH, or water and sanitation and hygiene, and also how students, young professionals, and youth advocates can play an important role in reaching our global goals. We'll talk about the WHO 2030 NTD roadmap, which provides the direction that we need to take in order to reach elimination, eradication, and control of neglected tropical diseases. And in the second part of the session today, we'll talk about the Kigali Declaration, which is a global policy document that will be used to secure the commitments that are needed to reach the WHO 2030 roadmap goals. So before we begin, I'd like to introduce a short video from the World Health Organization on NTDs. Oh, Claudia, we need some sound. Excellent. Thank you very much. And without further ado, I'd like to pass over to Dr. Afsa Rajabali, who's a member of the Threads Lab at the Briere Research Institute here in Ottawa. She's currently working as a research assistant on a treatment acceptability project for lymphatic filariasis in Papua New Guinea and in Indonesia, and is also part of an exploratory study on patterns of non-participation in public health campaigns. So Afsa, over to you and over to our panelists. Thank you.
Thank you, Allison. Good morning, good afternoon, good evening to everyone. As you might have seen in the email before the event, we are very fortunate to have a super panel today, and I'm personally very excited to hear what they are going to be talking about. I'll just start with the introduction. Our first speaker will be Kara Liblick. Kara is a medical student and master's student at Queen's University in Kingston, Ontario. She's also a member of the Emerging Leaders Group of the Inter-American Society for Cardiology. Welcome, Kara. Can we spotlight Kara, please? Thank you. Our second speaker will be Shomi Hassan Chaudhry. Shomi is an award-winning WASH activist from Bangladesh, an advisory board member of Youth Combating NTDs, and the co-founder of the nonprofit Awareness 360. Welcome, Shomi. And our third speaker is Alistair Mukandiwa. Alistair is a medical doctor and global health advocate. He's currently an advisory board member of Youth Combating NTDs and the co-founder of the nonprofit I'm Zimbabwean. Welcome, Alistair. Before I hand it over to Kara, I have a couple of notes. Each presenter will have a total of 10 minutes for their presentation. At the end of the 3 presentations, we will have a 15-minute question and answer period. I encourage all of you to post your questions in the chat as you listen to the presentations. Although the presentations will be in English, as Alison said, please feel free to type questions in French. Our team will help with the translation. Questions raised in this session will be recorded and shared in a document following the event. All right, over to you, Kara.
Hello. Let me just share a screen here. I will ask the classic question of, can everybody see my screen?
Yes.
Perfect, thank you so much. So my name is Kira. I'm a medical student as well as a master's student at Queen's University. My research is focused on linking cardiovascular disease and social determinants of health. Today, I'll be speaking to you about the NET Heart Project, which is the Neglected Tropical Diseases and Other Diseases Affecting the Heart Project, of which I'm one of the co-coordinators. And before I begin, I just want to acknowledge that Queens is situated on the traditional Anishinaabe and Haudenosaunee territories, and I'm very grateful to be able to live, learn, and play on these lands. So how do we get from cardiovascular disease to NTDs, and why do we really care about this? We know that cardiovascular disease is the leading cause of global mortality. Further, we know that over 80% of cardiovascular deaths occur in low to middle income countries, and 40% of those deaths are premature. So there's quite a high burden of premature cardiovascular disease in these countries. We also know that we can't fully explain the increase in cardiovascular disease in low to middle income countries with population density or traditional risk factors. So as you'll probably know, neglected tropical diseases impact over 1.7 billion individuals globally. And we know that NTDs are disproportionately high and have a huge impact in low to middle income countries. And we also know there are several cardiovascular implications of NTDs. So what we postulate is that cardiovascular implications of NTDs close the gap and help us better understand why there's a higher disease burden in LMICs. And we also know that inequities in access to healthcare in these regions make it such that the usual recommendations for addressing cardiovascular implications of NTDs don't necessarily apply. The NET Heart Project is an innovative project organized by the Inter-American Society of Cardiology under the Emerging Leaders Program. It focuses on making neglected diseases visible and analyzing their critical link with cardiovascular disease. The main goal is to be a useful tool for daily medical practice in the most affected regions. It was conceived in 3 phases, the first being a series of systematic reviews on different neglected tropical diseases and how they impact cardiovascular health. The second is a recently published textbook to summarize all of this. And now we're currently working on an app as well as several languages available for the textbook in the app as well. All of this is designed to help improve dissemination of knowledge, as well as helping implement practical and feasible medical strategies in locations where resources may be limited. In addition, the project is also a call to engage young advocates in the investigation of these entities and to promote global programs for the improvement in access to healthcare, financial well-being, and sanitation in affected populations. So for each NTD, we have kind of an algorithm that we use to approach it. The first pillar is epidemiology. So we want to know generally where are these NTDs most prevalent, and then where is the highest associated cardiovascular burden. This helps us target our information and give further information to healthcare providers on A, the likelihood of seeing the NTD in their own practice in their region, and B, which travelers from which regions may be at highest risk if they do present with abnormal cardiovascular symptoms or symptoms that can't be explained by any other underlying disease. Next, we talk about the pathophysiology, or the mechanism of how each NTD results in cardiovascular implications. This has not been fully elucidated for many NTDs, so we aim to consult experts in the field as well to better understand this relationship so that we can inform both prevention strategies as well as treatment recommendations. Next, we talk about symptoms and diagnosis. And importantly, we recognize that the standard in scientific literature is to recommend the highest specificity, sensitivity, diagnostic tools and interventions. And this information is important, but not necessarily actionable in regions where advanced diagnostic imaging may not be available. So for each NTD, we have kind of a dual approach and recommendations. We provide both an algorithm for how to detect and treat these CV implications or cardiovascular implications based on the highest quality literature, but then also based on different levels of resource availability. And this leads, of course, into our management and treatment algorithms that we recommend for each of the NTDs that we do talk about. So in terms of our project outputs, as I spoke about, we have the NetHeart book, which was really a collaboration between a large group of youth advocates and emerging researchers, as well as experts in the field, which allowed for a lot of mentorship and learning both ways, I believe. I also have 2 examples of some of the reviews that we published here. And then just to give you some visual insight into what each section can look like. So for each section, we provide a map like this that tells you, so this is for snake bite and venomation, where these conditions are most prevalent. Here we actually break it down by species of venomous snakes as well that you're most likely to see. And then we further have maps focused on just cardiovascular prevalence information, although this information is limited for some neglected tropical diseases where we don't see cardiovascular consequences as often. We also then try to provide a very simplified visual algorithm and then a more in-depth written algorithm for each neglected tropical disease. So here we see, for example, visceral leishmaniasis. So we talk about looking for signs or symptoms that suggest cardiovascular involvement. And then we also made sure to be very aware of other conditions that can be confounders and can also contribute to cardiovascular risk. So we know that for a lot of NTDs, for example, HIV co-infection can increase risk of cardiovascular involvement. And then you can see there, we list very small ECG or echocardiogram, but then we give a big write-up as into if you're in a setting which has echo available, here are the recommendations, here's what to look for. And then if you have ECG available, which is really one of our most powerful tools because it is not as technical, it's available in a lot of lower resource settings. And if you know what to look for in an ECG, it can actually tell you a tremendous amount about cardiovascular function and health. So that was something that we had a whole chapter on actually in our book as well. And then we also provide some just visual illustrations of, okay, how can this NTD actually impact the heart? So here we have schistosomiasis and basically how we can get from having this little schistosome outside of your body and how it can get to your heart and then actually cause cardiovascular implications. So in terms of conclusions of our NetHeart project, it's the first comprehensive review of cardiovascular implications of NTDs with clinical recommendations, taking into consideration the limitation of resources and impact on marginalized populations. It also demonstrates the importance of international collaboration in global health. Through the development of recommendations tailored to resource-limited settings, this project underscores also the importance of accessibility. And I think an important, I guess, next step for me in this presentation was to talk a little bit about how you can be involved in NTDs and if you're interested specifically in cardiovascular health opportunities there as well. So I mentioned briefly, but we have the Inter-American Society of Cardiology, which has an emerging leaders group, which is always looking for new members who are interested in being involved in a wide variety of projects, including our NTD work. And what's so great about this is that we focus on bringing in young researchers and advocates, pairing them with a mentor, and then hopefully enabling them to become mentors themselves to other new entering members. So it's really a passing down knowledge and empowering young people to be leaders type of structure. The next is that you can always raise awareness. So we know that data speaks, and the data on NTDs is very hard to argue with. The number one domestic policy issue is healthcare, and we've seen time and time again that the burden associated with neglecting disease is very costly to the government, and this is a way for us to make it a priority to politicians. And the more we as Canadians and young individuals express that we care about an issue such as NTDs and lobby for its inclusion in political platforms, and leverage our tools like social media to get their attention, the more likely it is that change will occur, which we've been really seeing throughout the pandemic, and how several social issues have really come to light, and change has come as a result of the use of things like social media. And then finally, to understand your individual impact. It doesn't matter who you are, just that you're passionate about inciting change, and social movements are the sum of many individual actions. What you choose to do with your time is incredibly valuable. So thank you for listening to me and attending this talk, because that really helps to increase your awareness and your ability to incite change as well. And I'm excited to have a discussion about this following the other panelists' presentations. Thank you very much.
Awesome. Thank you, Kira, for highlighting the NetHeart project and telling us how we can get involved. I'll pass it on to Shomi next.
Thank you, Afsa. I'm gonna share my screen first. Okay, I hope you can see my screen.
Yeah.
And so, yes. Okay, awesome. Well, that was amazing, Kira. I learned a lot from your heart project. Hi everyone, my name is Shomi Hassan Chaudhary, and I am tuning in from Bangladesh. It's like almost 9:30 p.m. here, today I'm going to be talking about integrating WASH in the battle against the neglected tropical diseases. I do want to acknowledge that I understand that this room is pretty diverse, and we may have participants who probably have never heard of WASH or the NTDs, and of course there are multiple experts here in the room too. So I will try to speak without any difficult jargons or acronyms, but WASH is an acronym that I'm going to be using a lot, and WASH stands for Water, Sanitation, and Hygiene. So I am a WASH activist myself. And I'm the co-founder of a global youth-led nonprofit called Awareness 360. And I started working on youth empowerment and in the sanitation and hygiene space. And gradually I also started looking into the NTD space. And I'm currently serving in the Youth Advisory Board of Youth Combating NTDs. I'll be sharing a little bit more about Youth Combat NTDs as well. But before I start off with my presentation, I'd like to show you a quick video that can sort of walk you through my personal journey of becoming a WASH activist. And I figured that maybe it's better to show a video than just me blabbering about it. So let me stop share, and I'm gonna share a different screen in a second. All right, here you go. I hope you can listen in. 45,000 people die from diarrhea every year in Bangladesh. It's easy to see that as just a number. When I tell them my mom died from it, it connects. It all started with my family. I grew up seeing my dad doing different kinds of events and voluntary work, and that really inspired me to give back to my community. During my senior year of high school, I went to the US under an exchange program, and we were required to do 40 hours of community service, but I ended up doing 460 hours. As a result of that volunteer work, I was recognized by President Obama. That was a very defining moment for me. That's when I started thinking about how can I bring those efforts back to my whole country. So in 2014, 14th of April, which is the Bengali New Year's Day, I lost my mother to diarrhea. She was sick for only one day. She went to work even the day before, and the next day she was dead. And that was a huge shock for me. 4
4 days after my mother's death, I gave my first hand washing and hygiene talk, educating 3,000 sewage workers. I started working with other communities like the sex workers community, slum dwellers. They lack very basic knowledge about sanitation and hygiene. For example, they don't know how to wash their hands properly, menstruation is a taboo, and they live in extremely unhygienic conditions. The more I was doing my work, the more I realized that we needed to do even more. I co-founded Awareness 360 to confront all sorts of issues around the world. Now, 6 years later, we are a big family of 1,500 young people. We are working across 23 countries, and our projects have benefited over 150,000 people. Young people do have the power to take on these goals. We just need to give them the right resources and skills. There are so many issues around us that need our urgent attention. At the same time, we do have hope for our future. We do have the belief that we can solve all these crises together. As long as we have solidarity, as long as we are united, we will be able to face all these challenges.
So I hope you enjoyed the video. Let me go back to sharing my presentation. Can you see my screen?
Yes.
Okay. But I'm not able to move on to the next slide for some reason. Let me restart actually. Sorry about that. Okay, I think now it's working again. Okay, cool. So thank you for your attention. Sorry about that. So yeah, so that's sort of how I came into the WASH space through my personal story. And as I have been working in the WASH space, I really got to see how important WASH is and the critical role that it can play in saving lives and in making communities better. And I'm going to talk about how WASH is related to NTDs in a second. But as I was speaking in the video about the power of young people, I think that really makes a good transition to Youth Combating NTDs, which is a global community of young people fighting against the neglected tropical diseases. So what we at Youth Combat NTDs want to do is mainstream the participation of young people within the NTD community. And we have several agenda items to go through. And just this last month, we met where my fellow panelist, Alistair, was also there. And we attended like a theory of change workshop where we were talking about what are the challenges, what can we do, and we were just coming up with different outcome pathways of how we can really achieve our goals. So what we at Youth Combat NTDs essentially want to do is we want to use our voice to engage, to empower and support youth communities and young leaders, including youth with disabilities, towards delivering and achieving the WHO 2030 NTD roadmap, thereby making sure that young people are not left behind in this fight against the neglected tropical diseases. We also want to bring in our creativity, our energy. We have organized storytelling festivals and different sorts of music videos and different creative methods where we want to bring in our sense of innovation, our skills with new technologies and our thinking and our talent to the fight against these diseases. We also want to engage and support international, regional, and local decision-making bodies in carrying out advocacy and delivering the WHO 2030 NTD roadmap. And lastly, we of course also want to promote and adopt healthy practices that prevent NTDs and also support mental health and well-being. So that's a little bit about what we do at Youth Combating NTDs. And of course, you're more than welcome to join this movement. Feel free to reach out to any of our social media or our website. Now, yeah, so today my main topic of this presentation is WASH, water, sanitation, and hygiene. And then I'm going to relate it to how it's important and why it's important to integrate WASH into the movement against NTDs. So as you can see, there's a striking fact here that worldwide 2.5 billion people do not have access to proper sanitation, and 1 billion individuals, 9 out of 10 of whom live in rural regions, defecate out in the open. And obviously, clean water and sanitation are one of the most crucial goals, since water is the cornerstone for healthy ecosystems, vibrant communities, and sustainable economic progress. Yet we've seen that there is a limited budget allocation to WASH, and especially during the times of COVID, where WASH is literally a prerequisite to combating the COVID-19. We still saw that there has been cut in investment in WASH, and WASH is also one of the Sustainable Development Goals. It's goal number 6, clean water and sanitation, and it's also heavily linked with other SDGs like quality education, good health and well-being, gender equality, etc. And I understand that we have a limitation of time, so I'm going to hurry up. So yeah, like as per the UN WHO, there is a $4.3 return on investment per dollar invested in water and sanitation in terms of decreased healthcare expenses for individuals, and of course there will be better productivity. And WASH is not only relevant to diseases like diarrheal diseases and those preventable diseases which are attributable to WASH, but also it's heavily linked to NTDs. So water, sanitation, and hygiene are critical in the prevention and management of all neglected tropical diseases. It is essential for the management and care of many NTDs. I'm sure many of you may know that some of the NTDs even lead to permanent disability. And for those people with those experiences, life is already hard, and it becomes even harder when they don't have access to basic rights like sanitation and hygiene. And WASH can also prevent exposure to many diseases. So what are some of our ways forward? Firstly, I think it's important that we talk more about WASH. We don't look at WASH, we don't look at NTDs and all of these different causes as separate, right? We need to really zoom out and look into the holistic nature of things and how they're so intricately linked, and really look into the co-benefits of these two things, WASH and NTDs. And instead of working in silos, I think we should integrate them together, and we should engage all of these different initiatives at the national, local, national, and global levels. Also, it's important to identify inequities through data sharing. We need more evidence. We need more evidence-based decisions. We need to prioritize investment and, of course, track and monitor our progress. And then, as I was saying, generating significant evidence and incorporating it into different strategies and guidelines. And of course, we can have different joint programs as well. So yeah, I mean, I think these are some of the ways that we can look into WASH and NTD not as silos, but something that are very, very much heavily linked. As WASH is something that can literally help prevent all of the neglected tropical diseases. So I hope I could shed some light on the importance of WASH when it comes to the fight against NTDs. I understand that there's a limitation of time, so I'm going to stop here, but I'm looking forward to Alistair's presentation and the panel discussion forward. Thank you.
Wonderful. Thank you, Shomi. Thank you for joining us late at night, sharing your story and explaining the importance of WASH in the prevention and management of NTDs. I'm just going to pass it to Alistair now.
All right. I'm grateful to be here, and I'll try to make it snappy. My name is Alistair. I'm a medical doctor by profession, and I'm from Zimbabwe. So I'll try to cut right to the chase. I'm very grateful for what Kira and Shomi said. Sometimes when it comes to issues such as neglected tropical diseases, and I'd argue even diseases in general, you need to take a step back and see the forest for its trees. You need to see the bigger picture, and you'll quickly realize that whatever field you're in, whatever stage that you're in your life, you can already put your foot in and make a difference, because it is so cross-sectoral. It can link very well with whatever you're doing at any stage that you're in. So what I'm going to try and just make a case for is how we can make sure that NTDs are integrated into our global health policy. Now, the first thing is global health is very dependent on local efforts. I would argue to say that a lot of people think of global health and they think very high level meetings, but a high level meeting is only as good as its local action. So we really need to think global and focus our actions on what we can do locally. So we're going to build our argument on three things. Why should we care? How do we get others to care? And what can we do now? Now, the why should we care question is very simple on my end, because I believe that we're all here because we have a bit of an interest in NTDs, but it's also very important for us to have a very good clarity on why we care about the causes we care for. So concerning NTDs particularly, my first experiences with NTDs were when I was very young. I grew up in a township in a very old city in Zimbabwe, and it was very common for you to see people with lymphatic filariasis. And these are very disfiguring and very visible diseases for anyone to have. And the most disturbing thing for me as a child was to recognize that there was no polite way in our native languages to describe these diseases. Almost every single word that is used in my native language to describe NTDs is derogatory. And that was already an indication that something was wrong. There was a fundamental issue with how these diseases were treated. So you can move on to the next slide. So the reason why we should care, in the next one, and the reason why we should care about NTDs fundamentally is because they're very common. It's very much possible that a lot of people have not had a very relatable experience probably with NTDs, but I'll tell you they're far more common than you'd imagine. More than 1 billion people in the world have been affected by NTDs. Actually, 1 in every 6 people have been affected in NTDs. But the thing that makes it so much of a pungent issue and a stench in global health is that you may go through a lifetime without seeing them simply because of where you are, because there's a gross concentration of these diseases in very poor and limited resource areas. And that is quite concerning. So the thing is, infectious diseases, even including neglected tropical diseases, do not have a tendency to discriminate. However, they thrive pretty well in environments we have already created through our own discrimination, either currently or historically. So fundamentally, this is a justice issue. And despite this pervasiveness and the fact that they are so debilitating, so difficult, they're actually pretty easy to treat. Low-cost interventions have tended to make a difference. There's a story that is quite well recognizable that when mass drug administration was done in a city in India in 2018, there was like over half of the cases that were endemic in that area were cured within 2 days of mass drug administration. So that's how efficiently these things can be treated. And as I've remarked earlier on, the fact that neglected tropical diseases still exist is a pungent stench on global health, and it's an indelible mark to the injustices in the world. And that is partly why we should care. We should move on to the next slide. So another issue that particularly is focused on why the youth should be engaged in this particular issue in this current moment is that you get to be part of a historical moment. So the WHO has a roadmap to eliminate neglected tropical diseases world over that ends in 2030. And that is a very realistic goal. And in this current time, when we're 8 years away from 2030, you have a stake at being part of the generation that changes the narrative when it comes to these diseases. And I'm pretty sure we all want to be part of a great moment. So it's a very good place to step in history. And beyond this, there's a historical springboard up. Canadian researchers have pretty much researched all 20 neglected tropical diseases. So there's an opportunity for the youth to create an intergenerational consensus and drive momentum through our innovation as youth, because there's already a solid scientific background, there's already a solid history of neglected tropical disease work that can be passed on from the last generation to the current generation. And COVID-19 has been a warning that we're only as good as our weakest healthcare system in the world. And we cannot rule out the possibility that any lack of health anywhere is lack of health everywhere. So we really, regardless of where you are, whether you've seen them or not, there's a position for you. And it really does affect certain communities in Canada. There's echinococcus, rabies, and scabies, which are actually pretty common in particularly low resource settings. So these are issues that if you just open your eyes, you will see them. We can move on to the next one. So how do we get others to care? The first thing that we need to do to get others to care, you can move to the next one, is that we need to have clarity on why the NTDs agenda is important and why it matters to us and why it should matter to the world. And something that is very central is demand creation, and we need to actually lead by doing. So I'll move on and explain what this actually means. Is you need to look at where you are, whether you're a professional in health or you're a professional in the financial sector. You need to identify how the NTDs agenda aligns with where you are. There is a case for fundraising that is there. There's a case for financing. There's a case for grant making. There's a case for even healthcare practitioners to plug into the NTDs agenda. So align it pretty well with what you are doing currently. And map out your stakeholders, people that can be engaged, because there's a gross lack of demand that is there within the NTD space. And beyond that, these are severely underfinanced issues. So you can already see where you can find yourself and you can champion from there. You can actually start doing something from that point of view. Then the next slide. So just the general rubric that you need to follow for you to get to others to care and to start advocating from where you are and start making a difference from where you are is you need to identify what's the most pressing issue. And some of the most pressing issues that the NTD space has is the lack of demand. People are not talking about it. And there's no motivation for policymakers to include something in the focus as a priority in their policy making if it is not demanded by their constituents. That means you need to make a story for you guys to understand, for your politicians to understand, for your senators to understand, for your parliamentarians to understand. And from then you need to empower your network and actually go through the messaging and the storytelling that is needed for neglected tropical diseases. The next one. And then you can implement campaigns from the level that you're in, whether it's petitions, letter writing, public debates, fact sheets. There's a lot that you can do. And it's especially important because there's a lot that you can do right now, which I will move on to real quick and just give you ideas as to what you can do at the current moment. The next slide. The next one, what we can do right now. So what we can do right now is we can start by having clarity on the issues. For us to create demand, we need to actually educate our stakeholders, present them with a good argument as to why they ought to be involved and in the work that you're doing in NTDs and in the work that can be done in NTDs. Focus them on the biggest pain points, which is the urgency of NTDs, the ease of elimination of NTDs, and the vicious effect it has on the world as a whole, and highlight the areas of scarcity. We have a scarcity of demand and a scarcity of finances, and then partner with their causes so that they get a return on their investment, whichever way it looks. So I will wrap up the discussion by just highlighting on a few areas that you can plug into. If you're into academia, research is very pungent in this place, particularly research that can influence policy and fundraising. Those are some of the areas. And you can get engaged with the work that we're doing currently at the Youth Combating NTDs. We have done, we've participated in high-level policy document crafting, partnering with WHO to curate youth events, global storytelling, some of which has been talked about by Shomi and the previous speakers, and the Kigali Summit is coming up. So you can also get involved with that. So the next slide will just give you a QR code, which you can subscribe to our newsletter and our social media handles and get involved with the work that we're doing and also start advocating from where you are. We can always assist with that. Thank you so much.
Thank you. Thank you, Alistair, for explaining why we should care about NTDs and sharing ways for you to be involved. Please feel free to write any questions you have in the chat box. Don't be shy. You can also raise your hand and ask your question directly to the panelists. So I guess I'll start with a question that I got personally. And maybe if on the background we could spotlight all the panelists, please. And the first question is, how can we continue to encourage the kind of regional and global collaboration that you all demonstrate in your research, implementation, and advocacy work? And Shomi, do you want to start us off?
I'm sorry, can you repeat the question?
Sure. How can we continue to encourage the kind of regional and global collaboration that you all are demonstrating in your research, implementation, and advocacy work?
Yeah, great question. Thank you, Absa. So I think there's a lot of opportunities out there. So for example, Alistair was mentioning about the Kigali summit that's happening. Then I know in Rwanda in June also the CHOGM is happening, the Commonwealth Heads of Government meeting, alongside which there's the People's Forum, the Business Forum, the Women's Forum, the Commonwealth Youth Forum. So I think there are so many different convenings that happen where if we really leverage these topics and bring these conversations forward and see how we can, and not just focus on the conversations, but also take all these awareness and conversations into action and really follow up through it, I think there is a huge opportunity there. So I definitely think that we can make the right use of all of these convenings and gatherings in a global setting, and all these different cross-regional initiatives and cooperations and platforms that there are. For example, ASEAN is there, of course, the UN, the Commonwealth. We could definitely, there's a lot of opportunities to collaborate through those platforms.
Thank you, Shomi. Kira, would you like to add anything from your experience?
Yeah, absolutely. I think something that I found interesting was that it's easy for us, I think, to talk to other people who are excited about advocacy and NTDs and think about it at the clinician level, but it's also important to think, how do we get this information in the hands of the people who need it most? So that is patients as well as caregivers in affected regions. And that's been something we've talked a lot about in our research group. Like, great that we publish something online or create a textbook, but how do we actually get this in people's hands? And I think that's where community partnerships and collaborations are important. And that's where we have to really just work on accessibility of care information. And how do we even get talks like this? How do we make them more available to individuals and more accessible with language as well? Like Shomi, as you were saying, we come into these talks and we're so knowledgeable and excited to talk about it, but we have to take a step back and say, okay, who is my audience and what type of language should I be using and what resources are most appropriate for me to be recommending?
Thanks, Kira. Alistair, would you like to add anything?
Yeah, I think definitely they've covered all I would think, but just an added thing is that there's nothing as encouraging as knowing that people can make a difference, one, and are making a difference too. So there's a role in amplifying the stories of what's happening, because there's actual work that is going on. If it is the funders, they need to know the actual work that is going on and the actual difference it's making in individuals' lives. So there's a role for even research into what is going on at the community level, what organizing is going on at the community level, and what difference is it making? Because it is indeed making a difference, but there's a role in amplifying that. So I think that's definitely one thing that needs to be done for momentum to be maintained in terms of the work that is going on around the world to eliminate neglected tropical diseases. So yeah.
Wonderful. Thank you so much, all of you. The next is a comment and a question from Allison. I'll read it out to you. Great point, Alistair, about the lack of demand to policymakers about NTDs. We are talking about integration of NTDs into WASH, global health equity, and non-communicable diseases in the panel today. You have made a clear link in your remarks. The question for the panelists is, what are some of the barriers to encouraging integration in your work, and how did you overcome them? Kara, would you like to start?
Yeah, I think some of the biggest barriers, I guess, into incorporating NTDs into our work, I think for us, it was the biggest thing was lack of available data. So we are working on neglected tropical diseases, which are named very appropriately, and working on a specific subset of outcomes in neglected tropical disease that really impact the most patients who have severe disease, so are untreated, which means they're more likely to be in a region where we're not collecting as much data. So I think for us, that's been our biggest barrier for overcoming that. I mean, I'll say it again, community partnership has the biggest thing, and not just relying on these high impact papers or talking to individuals working in North America, but it's talking to the clinicians who see this every day and who nobody asks about, which is crazy to me. But yeah, being able to find the right people to talk to and access, I guess, has been our other biggest barrier, but we've been very lucky in that we've built a strong network of passionate individuals, and the network kind of keeps feeding into itself and growing.
Great. Show me, Alistair.
So one of the ones that I've faced is there's actually a huge knowledge gap, as alluded to by Kira. And it's particularly interesting that even amongst people that you'd suspect would know a lot about NTDs, I, for one, can give you an example where I went through medical school all 6 years. I can only remember one lecture that specifically talked about neglected tropical disease. The neglect starts from there, and then it permeates to every other aspect of it. So there's definitely a knowledge gap that exists amongst even the communities that have a lot of people who have neglected tropical diseases. So it comes down to how we can communicate in the right language, both to the communities, both to the service providers in the communities. And usually that makes a compelling case already for NTDs, because I've seen very few people who know about NTDs who do not care about NTDs, because it's such an unfortunate scourge that we have in the world. So yeah.
Thanks, Alistair. I really relate to the one session in medical school about NTDs. Show me.
Yeah, I completely share the same sentiment as Alistair and Kara, and it's to be honest, it's sometimes it's frustrating to see that, you know, water, sanitation, and hygiene has the WASH has been neglected within global events. So, for example, the UN Food System Summit, the Africa Climate Week, both of them, they highlighted the lack of attention paid to WASH. But then I think it was a sign of encouragement where we saw in last year's in COP that WASH's incorporation was into like different climate talks and pledges, and there was a climate resilient WASH day that took place. So I think these are good progress. So the barriers that we have faced when it comes to our WASH work and NTDs is also, again, as Alistair mentioned, you know, the language barrier. Oftentimes, like I still remember when I first joined Youth Combat NTDs, I put up a story on my Instagram and I did sort of a random polling of how many of you know what NTD stands for. And I remember, I think it was only like 20% of my few Instagram following who said yes, that they know about NTDs. And the thing is, many of us probably even know, like we've seen some of the, you know, some people with lived experiences, but we just didn't know that this is what it's called. So I think what has sort of helped us in making people understand and help them, like, get them to join our movement is different creative means. For example, social media is big, you know, how we can use creative tools in making sure that we are mainstreaming these topics and we are making these more accessible. That has also helped.
Thanks, Shomi. We'll wait. Alistair just dropped off with some connectivity issue, and he will try to rejoin. Mingran will have another question, and that question is from Mujtaba, who says that, thank you for the informative session. What would be the best way to secure funding in Canada for a startup company that finds new drug for NTDs? And I think, Kara, since you're in Canada, maybe you could try answering that question.
Absolutely. I know that there are a lot of small business loan programs, as well as things like Kickstarter and funding opportunities like that. And that's where it comes back to really gaining momentum through social media. For something like Kickstarter, I've seen a lot of really amazing organizations that have been funded through that, as well as community and public health grants. And what I think it's been, I guess, one of the only good outcomes of COVID has been that we're realizing the importance of prevention, as well as the importance of public health care and things like neglected tropical disease, and how globalization really does impact not just other countries, but also like us here in Canada, and that we are part of a global community, and something that impacts over 1 billion people is something that we should be caring about, not just a little bit, but that every single Canadian should know about and support. So hopefully more funding opportunities are growing through that. I know CIHR, for example, is one of the bigger organizations that is starting to fund more startups. So
Thanks, Kira. One question that I received was, what has been the best part of being an advocate or an NTD researcher? Shomi, would you like to answer that question?
The best part of being an advocate for NTDs. I think it's to see that the power of young people, like experiencing that every day, you know, and then where you see and you realize that you're not the only one who care about these things, and there are other people who are also, you know, very much passionate about this cause, and to see them, you know, the energy, the drive that they bring into the space. I think that is very encouraging. Of course, this work as you know, as an entrepreneur, or whatever you call it, but as an advocate, we do go through it. It's quite challenging. This journey is not very easy. But then in terms of crisis, in terms of those challenges, I think it's the people that I work with who really drive me to push forward. So I think that's sort of the best part for me, to really see and live it every day.
Great. Kira?
yeah, I think the best part has been to see that there are so many people interested, and also just to create global collaborations and be able to increase awareness on NTDs, and see that moment of when you're talking to somebody about them, of people being like, oh my goodness, I didn't realize this was such a big problem. And that shows that the issue isn't really that people don't care, it's that people don't know. And I think that was a really nice moment of realization when that came to me, thinking, okay, what we need to do is just get this in front of people, and not necessarily have to convince them that it's important the same way, I guess. So I guess the amount of enthusiasm and uptake for people who do hear about NTDs and their impact.
Thanks, Kira. And with 2 minutes left in the clock, I would like to ask one last question to both of you. And the question is inspired from one that I heard last year in the Canadian Conference on Global Health. And the question is, if the global health genie came here right now and asked you about one wish that the genie can guarantee in the delivery of one message for youth advocates in NTDs to global health leaders, what would it be? Shomi or Kira, whoever is ready.
Well, I guess it would be to increase investment in NTDs, in the fight against NTDs. I think that would be like my one ask from the genie, because like as the name suggests, these are neglected. These are not receiving as much as the attention it deserves. So, yeah.
It would be just increased data collection. I mean, the thing that's going to inform how we best tackle NTDs is just to know more about them, how they impact people. And yeah, if I could just have all of the healthcare data in the world around NTDs right now in front of me and get a team together to analyze it, I think that would solve a lot of problems. So robust data collection is my ask from the genie.
Wonderful. Thanks to both of you, and thanks to Alistair as well. We've reached our time, but if there are any questions left in the chat, our team will be capturing them and we'll be following up in an email. Thank you again, Shomi, Kira, and Alistair, for being our panelists today. I really enjoyed the session and learned a lot from you three. And with that, I will pass it to Allison.
Great. Thank you very much. That's one of the disappointments of Zoom, is that we can't give a round of applause. So I guess a virtual round of applause to amazing panel. And as has been mentioned, I certainly learned a lot and loved listening to you all, and just inspiring comments coming from each of you. So thanks very much. And to ABSA as well for moderating that so beautifully. So we're going to move into this next section, which is really kind of practical. And we want to shift our gears to talk about the steps we can take to advocate for NTDs here in Canada. So we've heard about getting involved. We've heard about the Global Health Genie. Now it's time. Unfortunately, he doesn't come as often as we'd like him to. But we're now going to shift our gears to really talk about action that we can take. And to start out, I'd like to introduce Matt Hewsome, who serves as on the advisory board for Youth Combating NTDs, the global advocacy group that you heard both Shomi and Alistair speak about earlier. Matt is currently a facilitator and coach who's committed to pursuing mental health and racial justice, and is presently the director of strategic initiatives at Cities Rise, where he brings both grassroots and system-led efforts together to drive changes in mental health. So Matt, thank you for joining us today. He's going to just share a little bit about his recent experiences as part of the Global Youth Advocates Workshop in South Africa. And Matt is a Canadian, and so represents Canadian interests also on the Youth Combating NTDs. So Matt, we'll hand over to you for a couple of brief remarks from your South Africa experience. Thank you.
Thanks very much, Allison, and thanks to all the panelists. We'll be really brief. I think the panelists covered a lot. I think one of the key themes that came out of the time in South Africa, together with Alistair and Shomi, as well as from all of the panelists' remarks, is that NTDs and neglected global health issues in general are issues of justice, they're issues of accountability. They require more than just technical programs work, doing the epidemiology work, doing the technological innovation development, doing some of the policy change, more technical policy change work is important. And these things are nowhere near enough to drive the sorts of changes that we need globally for NTDs. And as we move in the session to talk about action, as someone who was trained in public health in Canada, as well as the US, as someone who's worked in the NTD field and the mental health field, I think just a reflection that we need to be focusing just as much on building our capacities for movement building, for community organizing, for activism, as much as we would want to build our capacities for epidemiological analysis or statistics or policy analysis or cost effectiveness work. And often what I've personally observed, and this is a generalization, is that public health education largely, and a lot of the technical mainstream work in fields like mental health and fields like NTDs will very much err on the side of technical analysis and not get into how are we going to address the political or structural determinants that are making these challenges. And so just on a note from a youth perspective, we have a lot to learn from the HIV/AIDS movement, how people, young people and others collaborated to drive pressure on pharma companies to allow countries in the global south and manufacturers in the global south to manufacture antiretrovirals and other things like that. As a combination of a wide range of different tactics, a wide range of work that was required. And I think as young people interested in driving change on issues that have been so neglected and issues that involve so much injustice, it's important for us to both draw inspiration from a wide range of sources and also look to ways of how can we or I build my capacity to drive these sorts of changes, because to contribute to movement building, to contribute to community organizing, to do activism work requires just as much thought and attention as training in more quote unquote traditional public health measures. So thanks very much, everyone, and I'll pass it back to Allison.
Matt, thank you very much. And as someone who teaches on Masters in Public Health and MSc Public Health courses, I completely agree with you. And it's something certainly that we as faculty need to be taking on board, your remarks. So thanks very much for sharing those. We're going to hear now a short message from Maëla Seguin, who is our Student and Young Professional Ambassador for the Canadian NTD Network. And Maëla is actually a nurse, and she's on shift today, and so was unable to join us in person. So she sent a short message introducing the Kigali Declaration and why it's important for her as the NTD ambassador for the, as the Student and Young Professional Ambassador for the Canadian Network. So we'll shift to Maëla, who will give us a short message here.
Welcome, everyone. My name is Maëla, and I am the Students and Young Professionals Ambassador for the Canadian Network for Neglected Tropical Diseases. As a healthcare provider, young professional, and an advocate for NTDs, I would like to introduce you to the Kigali Declaration for NTDs, a high-level political declaration launched in January 2022. The goal of the declaration is to mobilize the commitments, contributions, and collaboration needed to commit to ending NTDs as laid out in the World Health Organization's 2030 roadmap. Among the milestones listed include the eradication of guinea worm and yaws, as well as the elimination of at least one NTD in 100 countries. NTDs are also specifically listed as one of the targets of Sustainable Development Goal number 3, which is to ensure healthy lives and promote well-being for all. It's important to acknowledge that NTDs are diseases of poverty and affect 1.7 billion people worldwide. Commitment strategies, from policies to programs to financial investments, must aim to reduce poverty, address health inequities affecting populations living in vulnerable circumstances, and strengthen healthcare systems. Long-term sustainability of these strategies is essential to ending NTDs for good and for all. Achieving these ambitious goals will require commitments and partnership across global, national, regional, and community stakeholders. A multi-sectoral and multidisciplinary approach is vital to tackling NTDs. Crucial NTD partners include national governments, donors, private philanthropy, non-governmental organizations, research and academic institutions, as well as private sector companies. Youth voices can play a pivotal role in building and sustaining momentum towards NTD goals, holding governments accountable and contributing creative solutions to the complex realities of living with and at risk of NTDs. Countries, organizations, and institutions can commit to ending NTDs by endorsing the Kigali Declaration. As a Canadian, I am asking you to help me by adding your voice to the call to the Canadian government to endorse the Kigali Declaration. We'll have time to do this in our next session. Let's work together to make sure Canada is 100% committed to ending the neglect of NTDs. Thank you. Welcome.
Thank you, Maëla. And those are great remarks to spearhead us into the final part of our session today. So I'd like to hand over to Tina Lines, the Canadian Network's policy officer, who's going to walk us through the next steps and practical ways that we can work together to encourage the Government of Canada to get more involved in NTDs and endorse the Kigali Declaration. So over to you, Tina.
Hello, everyone. Thank you so much. It's lovely to be here with everyone today. I'm just going to we're going to do a little bit of advocacy and action together. And we're going to start first with a few Menti questions as well. And then we'll move into like a breakout session. Here, we'll present. Can you see it in full screen?
Yes, we can.
You can. Okay. So we have two Menti questions, and this first one is, what does the Kigali Declaration on NTDs mean to you? And if you go to www.menti.com and if you enter the code 3343639, then you'll be able to answer your a word or a short phrase that describes what the Kigali Declaration means to you. And we should be able to see it here as a word cloud. We have another question as well. And the second question is, what can you do to contribute to achieving the WHO NTD Roadmap 2030 goals? And this question should allow for full sentences. And we'll take a few minutes to do this. We have the words hopeful, awareness, commitment, motivating, accountability. I like that one. Roadmap, collaboration is such a lovely thing as well. Inspiring. I don't know if I can go to the next one, but if not, I will share those as well. Maybe we'll keep it on the word cloud. Any other thoughts on what the Kigali Declaration on NTDs mean to you? Okay. So here's our next question. Sorry, I just got a note saying that I needed to advance the question for you to advance. So hopefully this works. We heard a lot from Shomi and Alistair and Kira about what they're doing to contribute to achieving the WHO NTD roadmap goals. And I talked to people about NTDs. That's a great one. Share stories, advocacy and awareness, social media, meet with members of parliament, get involved, research. Think of ways to integrate NTDs in governance. Volunteer. Collaborate. So many ideas. That's lovely. So I'm going to stop sharing my screen, and we will have these up for at least for the remainder of this session. So please feel free to keep adding your ideas, and we will move on to our next session. And it's going to be focused on digital advocacy. And I'm just going to share a few things with you here. We will have a Jamboard. And that link is right here. Can you all see my screen?
Yeah.
So great. So this next session, we're going to go into a breakout groups. I'll put everyone into groups, small groups of maybe about 3 to 4 people. And what we're looking at here and what we're working on together is As you heard from Kira, Shomi, and Alistair, it's really important to speak to our governments and get our governments engaged and informed. So one thing that we do here at the Canadian Network for NTDs, our main work is advocacy and policy. So we thought we'd reach out to you and develop some messaging together that we can share on different platforms. And we also would like to get an idea from you what we can do for, sorry, I can't seem to get the screen to go down, but if you've got this there in your browser, we've got 2 questions. One is to create a message that can be shared on social media, and the other one is to help us create a list of organizations that we can reach out to that are youth-based organizations and are also organizations that would be interested in helping us amplify our NTD advocacy work. So I have just some suggested instructions here, and also just some basic questions that you may want to ask. How will you engage in? Who will you engage and how? And just thinking about who the audience is and what our intended outcome is. So here I have the link for the Jamboard. And just so that you are aware of something that we're working on right now is a letter to Minister Sajan, who is the Minister of International Development. And we would like to be able to share this letter that we have, where we would like youth and students and young professionals to endorse, ask him to endorse the Kigali Declaration. So please go ahead. I'm going to get us into our groups. I'll stop sharing my screen. And when we get into our groups, we're just going to also pause the recording, and you can work on both of these questions together. And if you have any questions, please put them in the chat. Hello, everyone. Has everyone been able to come back from their sessions? Thank you so much. I saw lots of suggestions in terms of who we could reach out to here in Canada, organizations, and also some really great messages as well that are coming out. Please feel free to continue to add to these. They will be open for a little while longer. So if something comes to mind today, then just feel free to just put it in those Jamboards. So I want to really thank everyone for taking the time to come today and to participate, especially in this advocacy and action workshop. We would like to share with you a very special video that we as a network were able to create to show all of the diversity of Canadians that are really working to prevent and treat NTDs here in Canada.
We have solved some of the greatest public health threats in the world.
Yet more than 1 in 5 people
still live at risk of neglected tropical diseases.
The worst part is
NTDs target our most vulnerable.
La meilleure partie est que
we have the tools to prevent
and treat NTDs.
We can bring about
un monde meilleur.
As Canadians
and as global citizens,
we are asking Canadian leaders
to take a stand
and sign
the Kigali Declaration,
joining the global NTD movement
so that we can prevent
and treat these diseases.
Let's commit
100% pour construire un monde plus sain
by ending the neglect
of neglected tropical diseases.